Again, I think it's helping them in their relationships with other people. I have this one patient that told me one time, hearing is something that you do for other people. And again, it's a way to connect with family and friends, and to help people do that more effectively, to ease sometimes family tensions, sometimes just to improve their quality of life, to open up some windows and doors in order for them to do things that they used to enjoy doing maybe, or to have them start doing some things that they can enjoy. That's important to me. And then just to have people know that I'm there for them. Sometimes they might not need me for a year. Sometimes they need me yesterday. And so I feel like that's my job, is to help them to continue to be at a level of performance that they expect. And so just help them with that. So that's what's important to me. You know, as far as diagnostically, there's different ways that we can evaluate hearing, particularly in young children that won't be able to participate in a behavioral test. There's ABR testing, which is auditory brainstem response testing, which can give a lot of ear-specific and tone-specific information, so without the child letting you know what they hear. But there's also a test called otoacoustic emissions that, and I think this helps most with when there's a child that's delayed in speech and language development, and it may be other developmental issues, not hearing acuity. So it's important sometimes to rule out for the family that it's not hearing, that they need to look to other professionals to help them with their child's developmental goals. So that's helpful. But I think then, as far as with hearing aids, as the technologies improve, we also have ways to evaluate the hearing aid's performance. And I use a technique called real ear measurement, where putting a probe in the ear lets me know what they're hearing in the ear canal. And it's a way to fine-tune the hearing aids, make sure they're meeting the audibility goals of the patient, and just give me some objective information. So again, that real ear measurement came out before some of the improvements in hearing aids, and sometimes you could see what you wanted to get but you couldn't get. But more and more we're able to achieve those audibility goals, the processing goals, in terms of reducing some background noise. So those things help, but you still have to counsel the patient in terms of what to expect, how to grow with their increased audibility, and that goes hand in hand with the improvements of technology. There are some patients that we get from neurology because they may be having changes in their processing that may be related to decreased acuity, may be related to maybe a recent stroke. Sometimes those patients also have balance disorders, and sometimes it can be something that falls into the ENT range, and sometimes it is more neurological. But we help them to define those differences and how they can get some help. And then with that, sometimes physical therapy may be involved too, because we assess what's going on with the person, but they may need some what they call vestibular rehabilitation and something beyond that what we do. So those are a couple disciplines. Also, there's, with pediatrics, sometimes a child is not meeting their developmental goals, and we help to provide that piece of information. Does it have to do with acuity? Does it have to do with how well they're hearing? Do they have chronic ear infections? Is that influencing it? Do they have a sensory loss that needs hearing aids or cochlear implant? So we work a lot with that department as well.